Hi everyone, so today we are going to work on the final part of treating our lower back indirectly, and where we are going to work on is the iliac crest, so part of our pelvis. So there are a lot of muscles of rotation and stabilization of the trunk and also the pelvis that's going to be involved here. So as well as helping the lower back, it's also going to help the pelvis muscles further up the chain, part of our breathing pattern, and also hopefully part of the glutes and TFL muscle that are running down into the lower parts of the leg then. So how we are going to start is you are going to find the two hip bones right at the front of the pelvis. So once you've found them, you're going to run further up along that bone, and we're going to come right up onto the ridge where you can fit your fingers in. So if you're too far forward, you won't be able to come towards the midline of the body, so you just come up to where you can come into the midline. So once you find that edge, I recommend to do it one at a time, but you can do it two at a time if you want to. So coming in to the midline of the body, and then you're going to press down onto the bone. So it is a difficult area to get into at times because of a lot of us are tight here. So what you can do is you can stand with your feet shoulder width apart. You can stand with your feet one foot in front of the other, and really use the movement of your pelvis. So play around with it a little bit to see where you can get the best angle of pushing down onto the bone. So you're pushing into the midline and then down onto the bone, and then you're going to lean slightly into the side while pressing down onto the bone. Use your breathing, taking deep breaths. Exhale. As you exhale and it starts to soften, you can get in a little bit deeper and a little bit further down. Once you feel possibly any pain patterns shifting, moving, getting softer, you can then start moving further towards the back along that bone. So again, coming out and then coming in and down onto that bone. You're going to be moving closer to the QL muscle at the back once you move further along that pelvis. So what you can do is you can stay one leg in front of the other, or you can come feet shoulder width apart. I find that a little bit easier. So we're coming now just from a little bit from behind here into that, close to that QL, in towards the midline of the body and down onto that bone, and really working in towards it. So this one can be quite sensitive. Just be very, very gentle with the area and work to whatever suits you. Once you've done one side, come across the other and do the same again. So using your in and down movement and using your breath. Once you have that released and we've done good work there, just do a very gentle stretch to finish. So bringing one hand just above your head, you're going to lean into the side to open up that space in between the rib cage and the pelvis. Take a deep breath and then exhale and come a little bit further. So just to top off that opening that you've achieved with those trigger points. So again, use your movement of your pelvis, change the position of your stance, and use your breath to really get into this point.